Namaskar. Today we will discuss a very interesting health question, and I think it will be helpful for all of you, especially who are suffering from allergy and obesity. So, here is a surprising health question. What do wheezing lungs, itchy skin, hives, a blocked nose, and excess body fat have in common? আমাদের যে সাই সাই করছে বুকটা, গা হাত পা চুলকাচ্ছে, র্যাশ বেরিয়ে চামড়াটা বেশ ফুলে উঠছে আমবাতের মতন, একটা নাক বন্ধ, হাঁচি হচ্ছে, নাকের ভেতর চুলকাচ্ছে, চোখ চুলকাচ্ছে, কাশি হচ্ছে, তার সঙ্গে আমাদের ওবেসিটি, এক্সেস বডি ফ্যাট, কিছু কি কমন ব্যাপার স্যাপার আছে? More than most people realize, or for years, we treated allergy in one clinic and obesity in another. Maybe we were thinking they are very strangers, but biologically, they often meet inside the same body. একটাই শরীর, সেখানে ওবেসিটিও রয়েছে, আবার অ্যালার্জিও রয়েছে. Just think of them as two fires that can share the common fuel. And that fuel is chronic inflammation. Body fat, যখন আমরা বলছি, it is not simply stored energy. It is an active organ. It releases different type of chemical messengers like leptin, certain interleukins, tumor necrosis factor, and that can keep the immune system on a very, we can say, alert mode, high alert mode. The names may be fancy, নামগুলো খুব সুন্দর, leptin, interleukin, cytokines, tumor necrosis factor, এরা কিন্তু ভয়ঙ্কর একটা ইনফ্লামেটরি ক্যাসকেড আমাদের শরীরের মধ্যে তৈরি করে. In somebody already prone to allergy, that background alarm may make symptoms harder to control. The clearest example is asthma. Extra fat around the chest and abdomen can physically restrict the diaphragm, and that make every breath more work. At the same time, inflammation associated with obesity can alter the airways. The result may be more breathlessness, more flare-ups, and in some patients, a weaker response to standard inhaler treatment. And the connection does not stop at lungs. In eczema, obesity may add systemic inflammation and disturb the skin barrier and our microbiome. আমাদের বন্ধু ব্যাকটেরিয়া যেগুলো আমাদের স্কিনেও থাকে, গাটেও থাকে, সেগুলোর মধ্যে একটা তাদের পরিবেশটাকে নষ্ট করে দেয়. এবং in allergic rhinitis, runny nose, sneezing, especially in children, excess weight has been linked to more persistent symptoms, although the evidence in adult is less consistent. But obesity, children, allergic rhinitis, symptoms will be more. So high fat diets, metabolic dysfunction may also disturb the gut barrier and immune tolerance. And their researchers are working on food allergy. In chronic hives, আমরা যেটা বাংলায় আমবাত বলি, a larger waist circumference has been associated with longer duration of illness. আমার পেটের সাইজ, অ্যাবডোমিনাল সার্কামফারেন্স যদি বেশি হয়, আমার আমবাতের ইন্টেন্সিটি, আমবাতের সাফারিং এর ডিউরেশন বেশি হবে। But this is important. This is not a story about blame. A person did not cause their allergy by gaining weight. Genetics, medicine, sleep, stress, hormones, environment, food access, and physical limitations. It is not only the physical inactivity, our physical limitations. These all matter. In fact, the relationship may run in both directions. কিরকম ব্যাপার, both ডিরেকশনে কিরকম যায়? এরকম নয় যে ওবেসিটি আছে তাই আমার অ্যালার্জি হচ্ছে। Oh, there are many other factors as we had discussed. Similarly, অ্যালার্জিও কিন্তু ওবেসিটিকে আরো aggravate করতে পারে। Like allergy can disturb sleep, asthma can make exercise frightening. আমার অ্যাজমা থাকলে আমি ভালো করে এক্সারসাইজ করতে পারবো না তো, অ্যাজমা যদি কন্ট্রোল না থাকে। And severe eczema can reduce the activity level. Repeated courses of steroid for this group of disorder may promote weight gain. Also certain antihistamine, অ্যালার্জির ওষুধ আমরা যেগুলো ইউজ করি, সেগুলো তো অল্প ওজন বাড়তে পারে। Then weight-related inflammation may make the original allergic condition more difficult to control. And that is exactly why we should address both conditions together. একসঙ্গে এর বিরুদ্ধে লড়াই করতে হবে। First, because we may otherwise miss the real reason that treatment is failing. Increasing an inhaler again and again may not fully solve the problem when the reflux is the reason, sleep apnea is the reason, reduced fitness or abdominal pressure is also worsening the patient's breathing. Second, because one coordinated plan may improve several outcomes. Better sleep, gradual physical activity, nutritious food, sustainable weight reduction can support lung function, metabolic health, and quality of life. So in people with asthma and obesity, even modest weight loss, maybe it is around 5 to 10%, has been associated with better symptom control, and also daily functioning will be improved. Coming to third, because early action can interrupt a vicious cycle. Vicious cycle কেন বলছি? Allergy limits activity. Inactivity promotes weight gain. And this weight-related inflammation worsen allergy. So this will be a vicious cycle. So what should patient expect? Not a lecture what we are giving. And also not a lecture about the number on the scale, the weighing scale. A proper assessment should include allergy symptoms, waist distribution, waist circumference, medicines, especially the dose of steroids. And there the allergen immunotherapy really works. If you take allergen immunotherapy, the need of inhalational corticosteroid, the dose of inhalation corticosteroid may reduce. You may need to take less antihistamine. So that is the main function of allergen immunotherapy, to reduce the medications for the sleep, the reflux issue, the diet issue, your movement, pranayama, yoga, mental health, practical barriers at home. So allergy treatment must continue. Please don't stop inhaler after this conversation. This is very important to note. If you require inhaler, please take that. If you require antihistamine, please take that. Consult your doctor. They will decide when to step down or step up. The skincare should be continued. Immunotherapy is a very important option, and we have now biologics, and emergency plans need to be prepared. When we require emergency, we need to use those medicines. Weight management is an additional treatment pathway. Weight management, again, we need to use it. We are not replacing the allergy care, but weight management is an important part in this allergy care. And the message is, our message is simple. When allergy and obesity travel together, treating only one may leave the other holding the march. So the march will be taken care of by that other part. So we need to take care both. দুজনকেই সামলাতে হবে, একটাকে আটকালাম আরেকটা কিন্তু চলতে থাকবে. We need allergy clinics now that look beyond allergen and obesity services, that ask about breathing, skin, food reactions, and hives. So in obesity clinic also, we need to think about this issues related to allergy, like breathing issues, any history of wheeze, cough, runny nose, sneezing, skin reaction, food reaction, আমবাত যেটা আমরা বলছি, urticaria. Because the goal is not merely a lower weight or fewer sneezes. It is easier breathing, calmer skin. We need our skin should be calm, safer eating, and of course, better sleep. With that, I think we can end here. If you have some question, please ask in the chat box. We'll try to address those.